Hope and Courage, a tribute to breast health on ABC 27, is brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. You still have a few minutes to get your questions in. Email your questions to questions@abc27.com or call the number 717-346-3333. The phone lines are open until 8 o'clock tonight. We do have time for one more viewer question. Michelle, here's the question. How many types of breast cancer are there, and is there one type that's more dangerous than another?
Well, Deborah, there are 5 main types of breast cancer with several subtypes in each category. And all of the research has really led us to the point where we're practicing personalized medicine. So treatments are based on individual biologic factors similar to what Dr. Truica had discussed. The most dangerous kind of breast cancer is the one that's left undetected. So get your mammograms when you're 40 and practice self-breast exams once a month.
Okay, Michelle, thanks so much for talking to us tonight. And we want to thank the specialists for answering your questions as well. Alicia?
All right, Deborah, thanks a lot. Let's get in another interview here. Joining us now is Dr. Allison Chetland. Thanks for being here. You know, in the last few years, there's been controversy about when women should start getting mammograms. Tell us your view.
Women should begin getting mammograms at the age of 40, and they should get them every year. Every major medical organization with demonstrated expertise in breast cancer care agrees, including the American Cancer Society, the American College of Radiology, the American Society of Breast Surgeons, the American Congress of Obstetricians and Gynecologists. And as mentioned earlier in the show, the U.S. breast cancer death rate has dropped over 30% since the early 1990s, and that's due to mammography.
You know, but we hear women who are saying, nope, I'm not going to get a mammogram. What do you say to them?
Oh, absolutely. You need a mammogram. I mean, it has saved so many lives. Very, very important.
Well, what fears do you hear? Why do women not get mammograms?
Well, some women are unnecessarily worried about mammography from a fear of radiation, especially to the thyroid. We've had some patients come in and ask for thyroid collars, for example. And wearing thyroid collars can actually be detrimental because it gets in the way of the exam, sometimes making it necessary for us to repeat the mammogram, thus doubling the dose. We know that the thyroid is not radiosensitive after the age of 30, and mammograms are performed in women over the ages of 40. It's the breast that's getting the dose, and we know that the thyroid gland, as well as the eyes, the salivary glands, the uterus, they get less than 2% of the average natural background radiation over a year. So it's a very, very low dose.
And you're doing some amazing research. Hey, thank you so much for being here with us
Thank you.
tonight. It was a joy to meet you. And thanks to all of you for sharing your stories, sending in your questions. We wish we had another half hour. But if you would like more information, or if you'd like to schedule an appointment at the Penn State Hershey Breast Center, just call that number, 1-800-243-1455, or just go online, pennstatehershey.org/breast. And don't forget to vote for the Pink Glove video. Vote for Hershey at pinkglovedance.com. Voting ends tomorrow. Thanks so much for watching tonight. Of course, we wish you good health.